All right, good afternoon and welcome to the LEA Special Education Information Session. We are the Office of Special Education Services, also known as OSIS, and today is August 19th, 2025. Today on our agenda, we have some OSIS updates, and then we have three guests from the early childhood services in the area of deaf education for our children who are deaf and hard of hearing, and they're going to talk to us about what's available in our state for those children. And then we'll have updates from SC teams. First up is Peter to talk to us about Medicaid reimbursement. And I did just, and I mean just, sent out the two memos. You've already received them, one back in June, one at the very beginning of August, but I just sent them to you so you'd have them fresh at the top of your inbox.
Yeah, we just wanted to make sure you guys got them. It gets sent out through the distribution that occurs from the department, and sometimes we find that some of our special ed folks don't always get it on the way that that's distributed, because it goes to superintendents and instructional leaders and special ed directors through that system. So we just wanted to make sure you guys got it. It's from Venetia Perrin, the director of the Office of Medicaid Services, and there was two. We just wanted to let you know that there were two memos. Originally, the memo went out, and I'm showing it here. It was issued on June 10th, and just had was a one pager. And then they provided some clarification because they got a number of questions from districts about it, and so they wanted to provide a little bit more clarification, and they even went into some of the procedure codes, category and procedure codes as well. So we're not really going to discuss it. It's just to highlight it for you, make sure you got a copy of it. If you have any questions regarding the memos, please reach out to OMS and to Venetia to get any clarification that you need. So just wanted to make you guys aware.
Thank you, Peter. Next, Katie Heiss for EdPlan SC updates.
Not a lot today. Just wanted to discuss a little bit about SSO. Moving through the process, we started with 22 districts that were using it, and now we're up to just 25. We had 3 tests last week, and 2 tests last week and 1 test this week. The connection, I was told that if it worked for a few districts, then it would work for all districts with the connection. So we're ready to start moving forward with adding people into having people access EdPlan SC through the State Link SC Learn. So I've been reaching out to districts, and so I think the easier thing to do for me to say is if you are 100% ready, you know that your teachers all see it, you all see it, and then what I say by see it is that you see State Link SC Learn, you're navigating it, they're navigating it, and you're like, Katie, we're ready. It would probably be easier at this point for you to email me and say, yes, we're ready, than for me to reach out and say, are you ready? Because I'm hearing from some districts that there's little things that they still need to work out, whether it's like district leaders, like the SPED side of the house doesn't have access to the ClassLink, State Link, just their teachers do. And so just a little piece of them making sure that when we make that switch that you're going to be ready. So if you are 100% ready and you know that like, yep, we're good. I communicate well with my IT my IT people, my ClassLink admin. I think teachers are ready. Let me know, and then we will start working with you to get that set up. And then if you're having any difficulties and you're like, no, like I need more help or support with, let me know as well, like either way, so we can start rolling out more districts. I know it's been a process, but I was really wanting to make sure that, you just don't wake up one morning and you had EdPlan that way and not all the teachers knew, and you were getting bombarded with emails, or if there was issues with users accessing it. So, and making sure that there's enough, Zendesk wasn't bombarded with a lot of emails all at once. So moving a little bit slowly with that, but for good reason. And we're working on setting up a protocol so that if there is a disruption, meaning that maybe the app it is not there when you go into SC Learn. We've had some disruptions, and so we had one earlier today that was about 30 minutes. And so what can be done is if you're using SSO, we would take your account, we could take a power user account, flip it over from OpenID to local, and then you would be able to access it. So I want to make sure that there's a solid plan, because I'm not always by my computer to get my email to say, hey, Katie, can you flip me over? So making sure that there's a solid plan for a protocol for when there is a disruption. So more information to come, but if you're 100% ready and you're like, we want to use this, just send me an email and I will put you on the top of the list to move forward. All right, thanks everyone.
Thanks, Katie.
Sarah, just before you go to Jenny, if I might, this is Carolyn from the data collection and reporting. I just wanted to let the districts know that the submission for Table 4 currently is still pending. There is no submission on Friday. We are still trying to resolve the issues with the Table 4 report. And so once we get that resolved, we will definitely keep everyone posted and give the LEAs enough time to validate their data before their final submission to the state. So just wanted to let them know that the Table 4 report is not due on Friday. Thank you.
Thanks, Carolyn. Okay. Jenny, you are up next to talk with us about the Office of Leadership Effectiveness Subgroup Support.
Thank you. I just wanted to let you know, we talked last time about, and I am so sorry, I'm seeing that slide is super blurry. I will make sure the slide is updated and clear to read, but you are the first to be invited this time. I know there was some discussion last time about people wanting to be invited to these wonderful work sessions that the Office of Leadership Effectiveness is hosting. Starting this year, they will be offered as 4 regional sessions that will be identical. We are going to be presenting in September. Our office will be providing information about the administrator's role in effective and collaborative efforts to improve outcomes for students with disabilities. And the audience for the September sessions will be more leadership teams. In October, the sessions will be more leadership teams as well, but also a lot of your instructional support, coaches, teachers, and other instructional leaders. And in October, we'll be our office, when I say our office, I mean in OSIS in collaboration with our wonderful SC teams. So Ask, Bask, Task, and Skippy are supporting us in this, and we're collaborative teams. But October will be the educator's role in improving outcomes with students with disabilities and alternatives to exclusionary discipline. And November, we'll be talking more about scenario-based, more behavior support. So then we'll be providing scenario-based work group, and Bask is going to lead that session. So we have a lot of great things going on. Special ed should have been invited from the very, very beginning. You were invited. It's just that I've heard that not many of you got the word. So you are getting invited first this time. You are the only ones to have this QR code at the moment. You are welcome to go ahead and register now. And you should be hearing something very soon. I think the first session is September 3rd. So you'll be hearing more information very soon, but go ahead and register. Please do not share this link out, though. It's not a public link just yet. So hot off the presses. Hope to see you there. Thank you.
Thank you, Jenny. Are these, so I'm assuming they're virtual. Are they, what time frame are they? Do you know?
Sorry, these are in person. These are in person for regional sessions.
Awesome. Okay.
So yes, sorry, I wasn't clear about that. Yes, these are in person,
regional.
and yes, and they are offered in 4 different locations. So once you register, you'll be able to see a little more information about that, and more information is coming soon. But don't hesitate to reach out if you haven't heard anything and you're wondering what's going on. You can send me an email. Thank you.
Thanks, Jenny. Great opportunity. Okay. Next, we have our three guests who are coming to talk with us about early childhood services for children who are deaf or hard of hearing. And first, we have Preston Tripp from Beginnings SC.
All right. Thank you so much for having me. Sarah, is it easier for you to just click through the slides for me as I go through? Would that work better?
Sure, yep. I'll mute myself and turn my camera off. You're welcome to
Sure.
turn your camera on, but
Okay.
I'll click through the slides as you tell
Perfect.
me.
Okay, well, great. Well, yeah, thank you for having me. Again, my name is Preston Tripp. I'm the Executive Director of Beginnings SC. Next slide. This is just a brief overview of our mission. We have a pretty simple mission, but it's basically, at the heart of what we do. Every child who is deaf or hard of hearing has the ability to reach their fullest potential, and that belief pretty much guides us to everything that we do. Next. This is our team. For those who aren't familiar with us, we are a small statewide nonprofit. And yeah, this is us. I'm the executive director. Megan Goodbar is our director of programs. Kelly Graham is our parent education specialist, and Gaia Cola Francesco is our DSS programs manager. We all come from different backgrounds. 3 of the 4 of us are actually parents of DHH children, so we bring kind of real experiences with us, and that kind of helps guide us through what we do. And then Gaia is in school to be an SLP. So we've got a variety of different backgrounds, but we all kind of come together and try to make this work as best that we can. Next. This is just a slide that kind of shows the agencies in South Carolina that, all coordinate together to help the families of DHH kids. In fact, some of these agencies will be following me. But families of children who are deaf or hard of hearing in South Carolina are not alone. There's a strong coordinated network of support available from the moment hearing loss is identified. This collaborative network ensures that families are supported emotionally, educationally, and medically at every step of their journey. Next. So we've got 2 major kind of programs that we, support kids and their families with. One is our Parent Support Services program. We have on-call coaching, which is designed to address critical concerns swiftly, offering parents immediate guidance when they need it most. Parent education, which is underneath this umbrella, is really at the heart of what we do. As soon as the child is referred to us, our parent educator, Kelly, reaches out to set up an appointment for a home visit. These are most often done virtually, but can be done in person if needed. During these visits, Kelly works closely with families to explore the child's strengths, needs, and abilities. She ensures that parents understand their rights, learn how to advocate for their child, support their development and learning, and access community resources and support systems. Building community among families is another cornerstone of our services. Through collaboration with agencies such as Hands and Voices and South SCSDB, we accomplish this through mingles, biannual conferences, and events such as our Back to School Bash, which we just had last month. Next. No 2 children we serve are the same. Each comes with a unique diagnosis, background, and set of needs, and our support reflects that. Next. Again, kind of under that same Parent Support Services umbrella, we also have several other programs. We partner with licensed child care centers across the state to offer a range of supportive services for children who are deaf or hard of hearing, their families, and the professionals who care for them. So first on the list is our loaner library services. We understand that resources to support access to sound, like hearing technology, accessories, can be costly. To help, we offer a retention device library where families can try on items like headbands, pilot caps, and retention clips before making any major purchases. One of my favorite parts of this program is our ability to provide remote microphone systems to child care centers at no cost. These systems ensure children have consistent access to language throughout their daily environments, not just during quiet one-on-one moments. In addition to technology support, we offer hearing screenings at child care centers, and this is one of our other major programs. We stay with families through the initial screening diagnosis, whether the hearing loss is temporary or permanent, helping them understand next steps and access resources early. We also provide tailored support for deaf parents who use ASL. Navigating childcare enrollment in a second language can be overwhelming. So we offer on-call coaching to help families access resources and arrange interpreting service to make the process smooth. Next. Yeah, as I mentioned previously, our hearing screenings are offered for free to licensed child care centers across the state. Our OAE screening process is based on recommendations by NCHAM, which is the National Center for Hearing Assessment and Management. So I'll give you kind of a brief rundown of how it works. We begin with 2 screenings. They're scheduled 2 weeks apart. During the first screening, we assess every child at the center unless their parent has signed an opt-out form. For the second screening, we only reevaluate children who received a refer result in either ear during the first screening. After the second screening, result letters are sent home to all parents. If a child is referred during the second screening, our DSS program manager contacts the parent, recommending that they schedule an appointment with their pediatrician for medical evaluation. Often, doctors discover excessive wax or fluid from ear infections and work with families to address these issues. Once any medical concerns are resolved, we return to the center for a final screening. If that child still receives a refer result after this third screening, we advise visiting an audiologist for more thorough evaluation of their hearing. And as this slide shows, our hearing screening initiative isn't just about identifying hearing issues early. It's about offering comprehensive follow-up to support families. Our goal is to reduce loss to follow-up, ensuring that every family receives the necessary guidance and resources. It's incredibly easy to request a hearing screening. A center just simply needs to visit our website, or if you personally know of a center that would benefit from this, you can scan the QR code right there and send them the link. We try to make it as easy as possible to do. Yeah, and then finally, thank you for having me. We hope you keep Beginnings SC in mind when working with families or children who are deaf or hard of hearing. If you have any questions, our programs or services, or if we can support you or your team in any way, please don't hesitate to reach out. We're here to help. Thank you so much.
Thank you very much, Preston. That's a lot of good information. Next, we have Jocelyn Ross from South Carolina Hands and Voices. Hi, Jocelyn.
Hello, can you hear me okay?
Yes, ma'am.
Okay, perfect. Thank you so much for the opportunity to be here. Again, I'm Jocelyn Ross, and I'm the president of South Carolina Hands and Voices. A little bit about our chapter of South Carolina, because we are a part of a national Hands and Voices, but only a state can only have one state authorized chapter. And so we're under the umbrella of National Hands and Voices, and we operate as a 501c3, and we've been operating for about 13 years. My why is 15, about to go on 16, and the newborn hearing screening indicated that she needs some follow-up and was later diagnosed with hearing loss. And we did the hearing aid process. And for us on our journey, we decided to do cochlear implants. But one of the things was you just wanted to talk to other people. Over 90% of families have no prior experience with hearing loss. And so when they get that diagnosis, you just want to absorb and get information. And it's great to have a support. And that's what we do. We're here to support families who have children who are deaf and hard of hearing. And we're definitely unbiased about communication modes. Whether you're manual, oral communication, we cover the umbrella. We understand that sometimes our families have to pivot on their journey. So to be able to get all of the information in one location is awesome. And then it also gives you exposure to families of different communication methodologies. But for us, we believe that families make the best choice for their child if they have access to good information and support. And when you get a diagnosis, it can be very emotional to get, and then that emotion doesn't go away. After you start processing, your child get older and have transitions, it's still so much to contend with. And we're here when they need us as a statewide chapter. And I like to show this picture of us in the state of South Carolina. And it's hard to see on here, but just imagine these are just all family pictures, and you'll be able to see it on another slide later, zoomed in. But a lot of, just like for my daughter, sometimes she's the only one or two children in a mainstream school environment who is around other deaf and hard of hearing children, and they want that environment. They want that identity to be with others, and families need that modeling and seeing that. So we have a community that we're building across the state, and it represents people of all different approaches. Again, it's parents and professionals, because again, we want to wrap them in accurate information. And so the different partners, just like Beginnings here, School for the Deaf and Blind that you will hear after us, several across the state, audiologists, ENTs, school districts, we partner with them so that our families can get unbiased, total information about deafness and hearing loss. And so again, we're just building that community of support for families who have children who are deaf and hard of hearing in the state. Next slide. And so what we like to do is kind of say we want to connect families. We want families to learn, but every family has something that they can share as well. And again, to be able to get families together, the research shows that there is just a need for something unique about talking to another family who's been there. It's an equitable relationship, that you're able to consult and see families of different walks of life. As Preston mentioned, no family is the same. There is a web of different situations between social economic status, educational level, the number of children, maybe your language background. So we do not come saying if you follow this method, you'll get this outcome. No, we're just giving people a place to come and be with others on a similar journey. Have young ones there. We go up to 21. We have deaf mentors that come out to our mingles and event. And it's all because along your child's journey, you're going through a maze of information and resources. So we definitely appreciate you all and the role you play in special ed services to get our families connected. And I like to show this maze in England because at this time when it came out, they did Sherlock Holmes. And that's exactly how I felt at the beginning of my journey with trying to absorb information and find information. And so we'll talk about how South Carolina connects families with resources across the state so we don't have to all get in this maze and get lost. We can build upon that information and get it in one place so our families have, in addition to what the information you share with them. Next slide. So again, the goal for Hands and Voices is to support them, academic, social, emotional, but whatever the goals they have for their family and their children, we want them to do. And so we do 3 things with support. And again, with us being part of National Hands and Voices, we as parent leads, who is an all volunteer chapter, all of our families are many professionals who are in the field, but have those families, but we all go through a National Hands and Voices training that keeps us unbiased when we work with families, and when we offer them support, and we make sure we say language like on my journey or on your journey, because again, we're respecting everybody in their walks of life. But on those walks, it's a lot of emotions that come with maybe hearing a diagnosis, maybe a child had hearing loss that changed, and you go through that again. Our kids get older, and then maybe middle school and high schoolers wearing device or having an interpreter in the classroom could cause different sorts of feelings and emotions, and you want to come together and be able to share that with people on similar journeys. As I mentioned, we have mingles across the state, and that's an opportunity for family modeling. Every family has something to share, and you would be surprised how down to the youngest child. I have a parent that reached out after a mingle, and their 4-year-old son said, "Oh, he has a Baha like I do." It really is for families to come together, learn. And when we go to the different areas, sometimes we come back and they would have made connections and they've gone Halloween trick or treating together. We really are trying to make those connections in the local community, as well as give that information out to them. So we have a wealth of information on our website, and I'll talk about that a little later. Next slide. So they say a picture is worth 1,000 words. So as I just mentioned, some of our services, we do referrals. Parents can find us on the website, sehandsandvoices.org. We have a public Facebook page, a private parent page that they can come on, as well as parents refer them to us. We have a lot of audiologists, speech pathologists who will send in a referral as they meet the agencies on here that will be speaking. They share information, and we're just trying to connect families and get them in a community. And we do that with the mingles, and they're in person, but sometimes people can't travel, so we do virtual. During COVID, we took advantage of that and did a lot online, and we would send out art kits, and the families got on virtually and colored and did everything. We sometimes have mom's night out and do yoga. We have people that come on and present for us. We had dad's night. So we're just trying to meet families where they are. Information and resources. We do a monthly newsletter. There's a wealth of information out there for the deaf and hard of hearing community, but sometimes it's just great if you can get it in your inbox and we reference different things. We also do Topic Tuesday. So we have sometimes parents that speak. Upcoming in September, we have a family member talking about her usher's diagnosis with her child, and we have an usher's adult who will be on there. We also have our professionals that come and share, SC Able, about finances and so forth. And so it's a great place to get information. And all of those events that have already happened are archived, and you can get that on our website as well. As I mentioned, Facebook, we do that, and exhibiting. So some of the pictures just to go through, starting at the top, that's my daughter actually a couple of years ago in a blue shirt, starting from the left. And we were in Charleston. Next to that, going to the right, we were in Conway. Next to that, with the SC Hands and Voices sign, that's Beaufort. Next to that picture going to the right, that's Columbia for Easter egg hunt. And all of these events are free to families. We're a volunteer, so parents and professionals can decide to contribute if they want to, but it is not a requirement. We don't want any hindrance from you joining. Proud to say that South Carolina Hands and Voices leads the statewide Deaf and Hard of Hearing Conference for families. And that's a picture of one of our conferences. We've held 2, and it's done biannually. Below that with the quilt, that was actually in Florence, South Carolina. We had some, no, excuse me, that's upstate, and underneath that is our deaf adults working with some of our students, learning some ASL as well as exhibiting. So we do things like this. We appreciate this opportunity, and we go across the state and exhibit. Next slide. So we try to give families a heads up because we know they contend with other things, their school and sports activities. So we like to give a calendar well in advance. That's the newsletter that I mentioned in Topic Tuesday. Again, we exhibit and we partner with school districts. We have one coming up with Richland 2 to do a mingle and a language learning activity for their families. So we do a lot of stuff. So any ideas you have, we're open. As I mentioned, we have resources on our website about the resources in South Carolina that gets that information. And that's just a snippet bottom right that shows you some of our archive to our Topic Tuesdays events. Next slide. So I know I gave you a lot of information. I do appreciate you guys. I wanted to give you the contact information. Hopefully at your leisure, you can go and look at the webpage, reach out to us so you can talk to us and get to know us better so that you can share us out to your families as a resource. So thank you for having me.
Thank you, Jocelyn, for all that great information. Sorry, I'm echoing. Okay, there we go. Lost my share. What's going on here? Okay, next we have Elaine Gentry from the South Carolina School for the Deaf and the Blind. So Elaine, you are next.
Hey everyone, my name is Elaine Gentry. I'm with the South Carolina School for Deaf and Blind. I am the Early Intervention Program Director here with the school. And I'm happy to be here. I appreciate the invitation. The first slide I wanted to go over with you all is related to an overview of our services. We are a statewide service. We are the IDEA Part C provider for deaf and hard of hearing services in our state. We do provide services from birth to age 5. Birth through age 3, though, are our BabyNet services. The 3, 4, and 5-year-olds are seen. We continue to work with them and their families on an as-needed basis, and I'll go over that just a little bit more throughout the slides. We do provide services in the family's natural environment. We do go into daycares. We go into the homes. We do go into preschool centers. We work very closely with the parents of the kids that we have, obviously, in order to help them and guide them in some decision making and things that are critical in these first few months and years of these little kiddos' lives. Like I said before, we do partner with BabyNet to provide the birth to 3 services. That would be our Part C IDEA services. And the kids that we do work with are the deaf and hard of hearing, the blind, and the sensory multi-disabled kids. Okay. We obviously work with the school districts, and we do begin that transition process whenever the kids are 2.5 into the Part B program. We will, like I said earlier, keep children in our 3 to 5 program if there are late referrals to the Part C program, or if there are other extenuating circumstances within the family. It's kind of like it's not an automatic that the children stay in our 3 to 5 program. It is a case-by-case basis, depending on the needs of the family and where they are in their process or their journey. Like I said, we do assist with that transition to the LEA through that transition process. The 2.6 and 2.9 reports and referrals go out from BabyNet, as well as from the service coordinators that we have that work in our program. We also work really closely with the First Sound program, which is with the Department of Public Health now. The First Sound program is our state EDDie program. They are the ones who are basically responsible for the newborn hearing screens across the state at the birthing hospitals. That program will work with those programs throughout the state to ensure that their staff are trained up to provide those newborn hearing screens. Once there is a hearing difference that is noted, then that starts the family's journey through or to begin with Part C through that program. And it all starts with that first initial referral to the BabyNet program. Okay. As I said before, we partner with a couple of different, several different programs across the state. We do partner with BabyNet, obviously, with Health and Human Services, but we also partner with the South Carolina Department of Disabilities and Special Needs, and we work closely with them in their Part C program. Typically, whenever those initial referrals are made, there may not be a diagnosis of a hearing loss yet. So we will work closely with their Part C providers as well to ensure that the referrals are made over appropriately to the services as needed. Some other community organizations that we partner with are obviously Family Connections. They're our state parent and training information center. Beginnings and Hands and Voices are great partners with us as well. Next. We, in our Part C program here with the School for Deaf and Blind, we're comprised of two sets of people. We have service coordinators. We have family trainers. Service coordination is one of the 16 services that all Part C children are entitled to. Service coordination is one that every kid who is eligible for the program receives, regardless of any other service that they may require. We also have family trainers who actually go into the families' homes and provide our families with that one-on-one intervention, developmental assessment, and work towards the different goals and outcomes that they may have for their children. Right now, our family trainers are comprised of teachers of the deaf and hard of hearing and teachers of the visually impaired. Those are our two. We also do have some special education teachers that provide family training for us as well. So we try to match up our family training services with the family's needs. Currently, right now, we do have two deaf members of our early intervention staff. So as Jocelyn was saying before, we try to provide that deaf mentorship to our families as they need it and as they're ready for it along their journey. But we like to provide the families with enough information so that they can make informed choices about potential equipment that may be needed, upcoming surgeries, and we try to match them up with some adult deaf individuals who can offer them some information about how it is to be a deaf adult and how it was going through college and through the workforce and different things like that. Also, too, we do offer an early intervention ASL class through our early intervention program. So our families that we have who do choose to use manual ASL and some who choose cochlear implant, like Jocelyn mentioned before, some families' journeys will pivot. So they may start out with a cochlear implant and then have to switch to learning ASL because, for various reasons. So we try to have all of our families enroll in our EI-ASL class. It's an online system that we provide for our families. We have our deaf staff who are the teachers of these programs. It's usually a 6-week class that we like to offer to the families. And we are just now starting this fall. We're going to start up working with families in person. So we're trying to branch out a little bit to offer that in-person connection as well as that online platform as well. Okay. Talking a little bit about our referrals whenever they come into the system. Like I said earlier, we do try to make sure that our children with hearing differences are linked up with our teachers of the deaf and hard of hearing, not only for their skill in American Sign Language, but also their skill development in listening and spoken language. We do have some of our TODs who have gone through certification programs for the LSL development, and most all of them do have a skill set in ASL as well to begin that early exposure and language acquisition and development in the babies that we work with. And again, our families are invited to join our EI-ASL classes. Again, that's an online module or setup for the families. They are offered access to a Moodle platform where they can access other types of videos and other resources and things from our deaf staff. We also have, like I said earlier, the teachers of visually impaired that'll work with families to really help with helping them understand their child's functional vision use. We also have some of our staff are orientation mobility certified to help those families get those little babies up and walking and moving. And also they will start with pre-Braille skills with the little ones as well. Next. And again, a little bit about our two sets of providers. Our family trainers work very closely with our service coordinators, really in the entire team to address all of the developmental potentials and concerns that can come up whenever we're working with the little kids. We try to address the things as early as possible so we can have intervention in place as early as possible. And which hence the name early intervention. The earlier we can get to them, hopefully the better outcomes and progress we'll see later. the families, caregivers, and the family trainers. We all try to work together to discuss ideas. Through the BabyNet program, Part C program, we do have service plans that are done every 6 months. So all team members have an opportunity to provide input on the child's progress and development, and which direction we need to go if we need to take different measures to meet goals and outcomes. Okay. All right, that's going to wrap me up for today. Again, my name is Elaine Gentry, and I'm the director of the Early Intervention Program here with South Carolina School for the Deaf and the Blind. I have 2 regional supervisors as well. Charles Jones covers the upstate region, and Susan Norwood covers the Low Country Coastal region. But all of our names and phone numbers are listed, and if we can be of any assistance or if you have any questions, we'll be happy to talk with you. Thank you so much.
Thank you so much, Elaine. Great information. Okay, next we have our SC Teams updates, and we'll start with Task and Joy Ivester.
Good afternoon, everybody. We are typically the last in line. We actually talked about renaming our project just so we could go first. So I appreciate that, Sarah. We wanted to share.
You're very welcome.
We wanted to share with you that we have our conference coming up, and each year we host a statewide conference that focuses on secondary transition and now also dropout prevention. This year we're again in Greenville, and we'll be hosting both breakout sessions, content sessions, and also a team planning summit. So we are refocusing on our local interagency team. So we're encouraging everyone to go ahead and get registered and consider sending a team to the team planning summit, which will be on Wednesday, October 22nd in the morning. And that is a free add-on for those local teams. We're encouraging districts to come with their local voc rehab representatives, DDSN providers, families, and others that they work with on those local interagency teams. We will also have our networking event and state transition award. So I would also encourage you to go to this website and nominate your teachers, your providers, students, and others for the state transition awards that will be awarded at the event. We also have a Hall of Fame where we're going to recognize our local teachers and other providers that are doing a great job in the area of secondary transition and dropout prevention. So we'll be celebrating success, learning, and networking, and building plans for the future. So the next slide. Also, I wanted to share with you for those districts that may have met the requirements under the determinations process, but would still like or need assistance in the areas of graduation rates, career readiness, transition, the South Carolina employability credential, and other areas to reach out to us. You can just email us, or you can go on the website and request assistance. But we would love to work with you in those areas. Next slide. Wanted to highlight also our website and the Task app to go there, encourage your teachers and other practitioners to use those resources that are available to them at will. Next slide. We have a couple of new initiatives within the South Carolina Employability Credential. We're seeing a lot of need in this area. For those of you, which is all of you, implementing the South Carolina High School Employability Credential, we have a new employer engagement webpage. You can use this QR code. And the idea is to share information and resources that can help market the credential to employers in your local communities. We also are really excited about a resource that was put together by one of our team members, Mike Stutz, along with some of the other post-secondary education institutions. They are community colleges and other institutions that have programs where you do not have to have a high school diploma in order to enroll in those programs. And it is wonderful. You can search by community college or those regions, and then learn about those programs that are available to your students who have not, who may have graduated with a credential, may have even dropped out, but these programs are still available to them. And I can tell you, when I saw it, the first thing that came to my mind was hope, and it gives hope to those students and those families that that are facing a future without that high school diploma. So please access that resource. It's really exciting that has been pulled together for our local students. Next slide. All right, Task App, we want to just highlight that there are learning modules for the credential, dropout prevention, and secondary transition. We have webinars, supplemental materials. We will get completion certificates out to those who complete those modules, and you can access those via the modules button on the Task App homepage. Next slide. All right, just an overview of resources quickly. You can read through this. Please know that we have a ton of resources on our website and app. Please encourage your teachers and your other staff to reach out and look for those resources in these different areas specific to graduation and dropout prevention. Next slide.
Excuse me, Joy, may I interrupt you for a question that's over in the chat?
Of
Adam wrote, are the programs you're referring to the various life programs?
So they're not actually, that's different. So this is a new initiative to gather information from community colleges about programs that students that do not have a high school diploma can access. If they've left school, that are interested in higher education, whether it's credential programs, certification programs, we now on that, if you go to that site on the QR code or to our website, you can access a list of programs that are available to students without a high school diploma. So where the post-secondary programs are more for students with intellectual or developmental disabilities, this is for any student or individual that has not graduated from high school with a high school diploma, may have a credential, may have just left school without a diploma, and can access these credential programs, meaning credential like HVAC, those kind of things, in higher education. Does that help clear it up? Yes, I can do that. I will drop a link in the chat. Do I have another slide?
This is
So-
this is one more. Yeah, you had this one.
Yes. Okay. I think we can keep going because I just described that.
Okay,
Thank
Yeah.
you.
this is your last one. Yeah.
All right. Thank you. Please reach out if we can do anything to support you. If you have any questions or comments or needs, we're here for you. Thanks. Thanks, Sarah.
Yep. Thank you, Joy. Okay. Next we have Carrie Canningeiser to talk with us about the Skippy updates.
Thanks, Sarah. Appreciate being here today. And I will follow Joy by talking about Skippy's conference. So our Early Childhood Inclusion Conference is on Thursday, September 25th. And much like the task conference, this is very specific, and this one doesn't focus on post-secondary transition. It focuses on your early childhood or your preschool students. And our goals for this year's conference are really to provide everyone that participates with strategies to embed specially designed instructional opportunities throughout the early childhood continuum of service delivery, and to empower participants to employ data-informed decision-making to improve child outcomes. We are so excited that our very own Kimberly Tussaud from Able, South Carolina will be our keynote speaker in the morning, and she'll be talking about how inclusion starts in preschool and not later. Then we have a variety of amazing sessions throughout the day, which I'll pop a link in the chat in a minute, but all of the kind of schedule information is on our conference website. And we'll be closing out the day with partners from the ARC of South Carolina and a panel of self-advocates who have been recipients of the Self-Advocate Award in South Carolina. So they'll be talking about keys to unlocking potential from preschool to possible. So we're so excited to have our local advocates partnering with us and sharing their experiences, their lived experiences, and kind of strategies and next steps for everyone. We also, registration is open through the 15th of September, and we are not able to offer on-site registration. So go ahead and make sure you visit our site and get registered. If you are interested in doing a bulk registration, if you have a group of folks from your district, we can also do that. All of the information is on the website, and when you click for registration, you'll see you can contact Suzanne Wingard, who is our events coordinator, and she'll help you with navigating all of that. And we also have a variety of training credits because we know that's important. So the whole conference is registered for CEUs. We also know that we'll have some of our early interventionist friends. So select sessions will be eligible for Part C credential. And we do have sessions that will be eligible for childcare training credit through SE Endeavors. So if you need DSS licensure credit, that's that one. So we're giving you a smorgasbord of training credits. And I see a comment in the chat. I'll get to that in a second, Elizabeth. And I think, oh, the last thing is for that conference, we'll be awarding our very first Growing Strong District distinction to celebrate a local district who's demonstrated commitment and passion for building strong foundations to improve outcomes for our littlest learners and their families. Thanks. Sorry, next slide, Sarah. Two more updates. These are just from some other opportunities that we have that fall nicely in line with the beginning of the school year. We have an asynchronous online course through Canva, evidence-based practices in action back to preschool. So this is a great time to use this resource to help thinking about how the learning environment is designed, setting up those schedules and routines, and connecting with kids, families, and colleagues. If you want to use this, but you also want some support with how you can use these modules, you can connect with us for technical assistance, and I'll put more information in the chat for how you can do that. And we hosted a webinar probably about a month ago now around the early childhood performance factor. So that webinar was recorded and that is available for anyone to check out if you'd like to learn a little bit more about the indicators related to preschool environments or preschool LRE and child outcome summary. Again, that's widely available for you, but if you want to do some unpacking, if you want some support, Skippy can help you with that. And Elizabeth, can you put your email in the chat so I can make sure that we get back to you? Sorry that happened. Got it. Thanks so much. And I'll throw these other links in the chat, but if you have questions, just let me know.
Thank you, Carrie. Next, we have Deanna Parrish to about the Academic Alliance.
Hi, everyone. I'll wrap this up quickly. Just want to remind you of our back to school resources available. So there's a link and a QR code. You can find the resources for teachers and administrators, and some upcoming events are listed on there, as well as instructional resources. And the last slide is just about our upcoming events. And you can register for all of these with a link to our calendar. It was at the bottom of the last slide. So when you get this, you can go to our webpage and the calendar and you will see the registration link. And then for all updates and monthly news, connect with us by scanning this QR code for our newsletter. That's it for me. Have a great day.
Okay. Thank you, Deanna. I believe that wraps up our, did we have one more thing? Oh, Jenny, you were going to put,
Yeah,
thank you, go
I
ahead.
just dropped that link. Yes, sorry. I've already recreated the slide, so Sarah will be adding that. Thank you, Sarah, to the slide deck. So the Office of Leadership Effectiveness subgroup support sessions, the link is in the chat for special ed directors who would like to register for that now. Directors or coordinators, of course, and that slide will be updated soon. Thank you.
Great, thanks, Jenny. So we'll see you again right here on September 2nd. Thank you, everyone.
Hey, Miss McKay.
Yes, ma'am.
I have a question. Is there a link for the September 2nd session, the LEA session?
There is.
Could you share it in the chat so we could have it, please?
Sure. Now I thought, let me just stop this recording.